Hi, welcome to the channel. I am Mohammed Moin. Today we're going to discuss a very interesting case of Ectropion Uveae. That means the uveal tissue is upside down, so it's sort of everted outward. So what is the condition that would actually cause the uvea to evert out? Well, the condition is rubeosis iritis. So you can see the pupil, sometimes when you see it, it has got that blackish tissue and you're worried what this black tissue is. Actually, this black tissue is the back side of the iris which has been everted out. Here you are seeing that in this patient, in which you can see this is everted out because this area over here, becomes black over here. This area where you see over here, this is black over here. This is the margin of the uvea. This is the Ectropion Uveae which you see in this patient, and this is a feature, as I told you, with Rubeotic glaucoma. So this patient, let's go forward with this patient. This patient has got a Rubeotic glaucoma. This is a patient with pseudophakia. You can see the intraocular lens which is in place, which is in the bag, and it looks like it's a double C-shaped haptic IOL. There seems to be more of pupillary dilation inferiorly than superiorly. And you will see, I'll zoom up the area, and you will see the area of rubeosis, especially on the irises, which is very clear in this patient, where you will be able to see the rubeosis on the surface of the iris. And this is the area, so I'm trying to see if there's any flare or cells in these patients, but there's nothing that we could see in this patient here, over here. So this is the area of rubeosis which you see over here in the iris, and this is the area which is very important to look at. And rubeosis can actually start off in the angle or on this margin of the iris. So if you do not see any rubeosis, then you always look for that. And you will see he's got NBD on the back of the retina over there, and then with multiple hemorrhages, and there's no laser scars over there. So this patient is a diabetic, and diabetics, if they do not get the PRP, then rubeosis is one factor which will come in, and that can damage their vision permanently. So it's a very difficult condition to treat. So the patient was presenting probably here, the patient's intraocular pressure was 35, but they was not producing any corneal edema. But the treatment of choice in these patients, which I would do, is I would go in the first treatment you would give it is anti-VEGF with intraocular pressure high. When you give the anti-VEGF, you need to drain some of the anterior chamber aqueous or aqueous tap to equalize the pressure, because otherwise you can easily get a central retinal artery occlusion with that intravitreal injection. So you give that anti-VEGF that reduces that rubeosis slightly and sort of acts on the posterior fundus as well, and the cornea is clear, then you immediately go in for van-retinal photocoagulation. Obviously, you're giving them anti-glaucoma medication all the time, oral and topical, on maximum treatment. And once you've got that PRP done, the next step is either glaucoma filtration surgery. So a glaucoma valve or stent is one of the best procedures to do, because the rubeosis is present in the angle. If you do a trabeculectomy, it has got a major failure rate. Even if you have to do a trabeculectomy, you will have to do more of a corneal trabeculectomy, so that you do not get problems in fibrosis. And the major problem which you get in trabeculectomy or any surgery with these patients is hyphema. So before the advent of the anti-VEGF, it used to be a very challenging case, and you wouldn't get the vision back, or the surgery would be complicated by hyphema, and that would sort of diffuse the purpose of doing surgery. So this is an important case. You must remember that can come as a long case or a short case in an exam, patient with Rubeotic glaucoma. And you should know that actually cataract surgery makes the proliferative disease more severe, and they progress to rubeosis much early in these patients. So if somebody's got an acute rise of pressure in glaucoma, always look for angle rubeosis on the surface of the iris or the angle. And the important thing is they might present with corneal edema and no rubeosis, because when the pressure goes high, it presses on the blood vessels of the iris and produces that blanching of the blood vessels, and that would sort of mask the rubeosis which you see. So it's recommended you treat the glaucoma with oral, topical, or IV mannitol, and once it comes down, look for the rubeosis and then decide your treatment accordingly. If you like the channel, please don't forget to subscribe and like the channel. Thank you very much for watching.